You're in the shower, you're washing, and suddenly your hand stops. There's something there, something that wasn't there before. Or maybe you just never noticed it. A lump. And in that moment, your heart drops, your mind races. And first thought that hits you is this a cancer? I'm Dr. Alex Popadich, a breast surgeon, and I've had this conversation with hundreds of women, and I know exactly what's going through your mind right now. You're scared, you're confused, and you're probably already on Google reading the worst case scenarios. But here is what I need you to know. Most breast lumps are not cancer. In fact, if you're younger, the chances are very, very low. But that doesn't mean you should ignore it. In the next 20 minutes, I'm going to walk you through exactly what to do if you find a lump in your breast. Step by step. No medical jargon, just clear, practical advice from a breast surgeon who does this every single day. Because the worst thing you can do right now is panic. The second worst thing, ignore it and hope it goes away. So let's talk about what you need to do. And more importantly, what you need to know to stay calm while you're doing it. Here is the first thing I tell every patient who comes into my clinic worried about a lump. The vast majority of breast lumps are benign. They're not cancer. But here is where it gets important. Your age matters a lot. If you're in your 20s or 30s, the chance that a lump is a cancer is extremely low. We're talking less than 5%. Most of the time, what you're feeling is normal breast tissue, a cyst, or a fibroadenoma, which is a benign lump that is very common in younger women. If you're in your 40s, the risk starts to go up slightly. But even then, most lumps are still benign. If you're in your 50s, 60s, or older, the risk gets higher in each decade. It's still not guaranteed, but higher. And that's why we doctors take lumps more seriously as you get older. Now, here is something really important. Where you are in your menstrual cycle matters. Some women know this, some may not. If you're premenopausal and you find a lump right before your period, there is a good chance it's just hormonal. Your breasts change throughout your cycle. They get lumpier, more tender, more swollen. So if you find a lump a week before your period, don't panic. Wait until after your period is over. Check again. If it's gone, it was hormonal. If it's still there, then you need to get it checked. But if you're postmenopausal and you find a new lump, you need to see a doctor. Because after menopause, your breasts shouldn't be changing like that anymore. Now, you might be thinking, okay, Alex, how do I know my lump is one of the benign ones or if it's something I should be worried about? And that's exactly what we need to talk about. Because there are certain red flags that tell us a lump needs to be investigated immediately. Not all lumps are created equal. Some lumps have characteristics that make us more concerned. And if your lump has any of these red flags, you need to see a doctor as soon as possible. Red flag number 1. The lump is hard and doesn't move. Benign lumps like cysts or fibroadenomas tend to be smooth and mobile. You can push them around a little bit. They feel like a marble under the skin. Cancerous lumps tend to be hard, irregular, and fixed. They don't move easily. They feel like they are stuck to the tissue around them. If your lump feels hard and fixed, that's a red flag. Red flag number 2. The lump is painless. This one surprises lots of people. Most women think that if lump hurts, it's a cancer. But actually, it's the opposite. Benign lumps, especially cysts, are often painful or tender, especially before your period. Cancerous lumps are usually painless. You can press on them and they don't hurt. So if you have a hard, painless lump, that's a red flag. Red flag number 3. Changes to the skin or nipple. If the skin over the lump is dimpled, puckered, or looks like an orange peel, that's a red flag. If your nipple is suddenly inverted or pulling to one side, that's a red flag. If there is a discharge from your nipple, especially if it's bloody or coming from just one duct, that's a red flag. Red flag number 4. The lump is getting bigger. If you've been watching a lump for a few weeks and it's growing, that's a red flag. Benign lumps can grow, but they usually grow slowly. Cancerous lumps tend to grow a bit faster. Red flag number 5. You have family history of breast cancer. If your mother, sister, or grandmother had breast cancer, especially at a younger age, your risk is higher, and any new lump needs to be taken more seriously. Now, here is the important part. Even if your lump doesn't have any of these red flags, you still need to get it checked. Because the only way to know for sure if a lump is benign or cancerous is to get proper investigations done. Which brings us to step 2. So you found a lump, you've checked for red flags, and now you need to see a doctor. But here is where a lot of women get stuck. They're scared. They don't want to waste the doctor's time. They think, maybe it's nothing. Maybe I'm just overreacting. Let me be very clear about this. You're not overreacting. You're not wasting our time. If you find a lump, you need to get it checked. So go and get it checked. But what happens when you go to the doctor? What should you expect? When you come to see me or any breast surgeon, the first thing I'm going to do is ask you questions. When did you first notice the lump? Has it changed in size? Is it painful? Have you noticed any other changes in your breast? Where are you in your menstrual cycle? Do you have family history of breast cancer? Then I'm going to examine your breasts, both of them, not just the one with the lump. I'm looking for the size of the lump, the shape and texture of the lump, whether it's mobile or fixed, and any skin changes, any nipple changes, any lumps in your armpits, like lymph nodes. This takes about 5 to 10 minutes, and it gives me a lot of information. But here's the thing. I cannot tell you for certain if a lump is benign or cancerous just by feeling it. Nobody can. Not even the most experienced breast surgeon in the world. The only way to know for sure is to do imaging and, if needed, a biopsy. So after the examination, the next step is imaging. And this is where a lot of women get confused, because there are different types of imaging, and which one you get depends on your age and what we're looking for. There are 3 main types of imaging we use to investigate breast lumps: mammograms, ultrasounds, and MRI. Mammograms are X-rays of the breast. They're very good at detecting lumps as well as calcifications, which are the calcium deposits. They're the gold standard for screening in women over 40, which means is they're the best test for screening women in over 40s. But here's the problem. Mammograms don't work as well in younger women. Why? Because younger women tend to have denser breast tissue. And denser breast tissue shows up white on a mammogram. Cancer also shows white on a mammogram. So if you have denser breasts, it's like trying to find a snowball in a snowstorm. The cancer can hide in the white tissue. That's why in younger women, we often use ultrasound instead, or we might need to do an MRI. Ultrasounds use sound waves to create an image of breast tissue. They're very good at distinguishing between solid lumps and fluid-filled cysts. If you are under 35 and you have a lump, we'll usually start with an ultrasound. If you're over 35, we'll usually do both mammogram and an ultrasound. MRI stands for magnetic resonance imaging, which is a big magnet that looks at the breast tissue. It's used for women with high-risk family history, like BRCA-like family history, or women who have very dense breast tissue, and they are over the age of 35. Now, here is what we are looking for on imaging. Is the lump solid or fluid-filled? If it's fluid-filled, it's a cyst, and cysts are benign. We can drain them if they're painful, but they're not cancer. What does the lump look like? Does it have smooth edges or irregular edges? Smooth edges usually mean a benign lump. Irregular edges are more concerning for a cancer. Are there any calcifications? Certain patterns of calcifications can be sign of early breast cancer or DCIS, which means ductal carcinoma in situ. After the imaging, we'll have a much better idea of what we're dealing with. But sometimes imaging isn't enough. Sometimes we need to take a sample of the lump to look at it under a microscope. And that's where the biopsy comes in. It's the test that will tell us exactly what we are dealing with. Now, I know the word biopsy sounds scary, and I need you to understand something important. A biopsy doesn't mean you have cancer. It just means we need more information. Biopsy is when we take a small sample of tissue from the lump and send it to a pathologist to look at it under a microscope. There are different types of biopsies, but the most common one that we use for breast lumps is called core needle biopsy. Here is how it works. We numb the area with local anesthetic. You will feel a pinch like getting a blood test, but you won't feel pain during the biopsy itself. Then, using the ultrasound guidance, we insert a needle into a lump and take several samples. This whole thing takes about 10 to 15 minutes. You might feel some pressure or clicking sound as the needle takes the samples, but it's not painful. Afterwards, you might have some bruising or soreness for a few days, but most women are back to normal activities the next day. The samples are then sent to a pathologist who looks at them under a microscope and tells us exactly what the lump is made of. The results usually take about 1 to 2 weeks. And this is the part that's hardest for most women, the waiting. You found the lump, you've seen the doctor, you've had the imaging, you've had the biopsy, and now you have to wait. And during that week or two, you're going to imagine the worst. You're going to struggle to sleep. I know. I've seen it hundreds of times. Here is what I want you to remember. most biopsies come back benign. So try and stay calm. Try and stay busy. And try not to Google too much. I know that's easier said than done, but Googling will only make your anxiety worse. So the results are back. And now you're sitting in the doctor's office waiting to hear what they found. This is the moment you've been dreading. And depending on what the results say, your next steps will be very different. If the biopsy comes back benign, that means the lump is not cancer. It's something harmless like fibroadenoma, a cyst, or just normal breast tissue. This is the outcome for most women, and it's a huge relief. But here is what happens next. If a lump is a cyst, we can drain it if it's painful. Otherwise, we just leave it alone. Cysts are very common and they're not dangerous. If the lump is fibroadenoma, we usually just monitor it. Fibroadenomas are benign growths that are very common in younger women. They don't turn into cancer. We only remove them if they are getting bigger or if they are bothering you. If the lump is normal breast tissue, we reassure you and tell you to keep doing regular self-exams and come back if anything changes. The key message here is benign means not a cancer. You're okay. But you should still keep an eye on your breasts and report any new lumps or changes. Now, sometimes the biopsy comes back with something in between benign and cancer. Something we doctors call atypical. And this is where things get a bit more complicated. Atypical results mean the cells in the lump look abnormal, but they are not cancer. Not yet. The most common atypical findings are atypical ductal hyperplasia or ADH, atypical lobular hyperplasia or ALH, lobular carcinoma in situ or LCIS. These are not cancers, but they do increase your risk of developing breast cancer in the future. Think of it like this. If normal cells are 1 and cancer cells are 10, atypical cells are 5 or 6. They are on the path of possibly becoming a cancer, but they're not there yet. If you have atypical cells, we often recommend 1, surgery. In some cases, especially if the atypical cells are widespread, we might recommend removing the affected tissue. Or 2, close monitoring. This means more frequent mammograms and clinical exams, usually every 6 to 12 months instead of every 1 to 2 years. And this decision depends on your individual situation, your age, your family history, and your personal preferences. But the key message here is atypical is not cancer, but it does mean we need to watch you more closely. And then there are the results that nobody wants to hear. The biopsy comes back positive for cancer. If the biopsy shows cancer, I know your world just stopped. You're not hearing anything else the doctor is saying. You're just thinking, I have cancer. I'm going to die. But here is what I need you to hear. Breast cancer is not a death sentence. The survival rates for breast cancer are better than they've ever been, and they're getting better every year. If breast cancer is caught early, the 10-year survival rate is over 93%. That means 93 out of 100 women are still alive 10 years after the diagnosis. Even if a cancer is caught at a later stage, the treatments we have now are incredibly effective. So yes, this is scary. Yes, this is life-changing. But it is not the end. Here is what happens next if you're diagnosed with breast cancer. Step 1, we figure out what type of cancer it is. And we will tell you this with the results of your biopsy, because core biopsy will provide us with all this information. There are different types of breast cancer. Hormone receptor positive, estrogen positive, or progesterone positive are the cancers that respond to estrogen. And this is majority of breast cancers because our normal breast tissue responds to estrogen and progesterone. HER2 positive breast cancer. These cancers have a protein called HER2 that makes them grow faster. Or triple negative, and these cancers don't have hormone receptors or HER2 receptors. Knowing which type of cancer you have determines what treatment you'll need. Step 2, we figure out the stage. Staging tells us how big the cancer is and whether it's spread to the lymph nodes or other parts of the body. Stage 0 or stage 1 is early breast cancer. Stage 2 or 3 is more advanced but still treatable. Stage 4 means it's spread to other organs. Step 3, we make a treatment plan. Treatment usually involves some combination of surgery, which is either lumpectomy, removing just the cancerous lump, or a mastectomy, which is removing the whole breast. Radiation, to kill any remaining cancer cells after surgery. Chemotherapy, to kill cancer cells throughout the body, and hormone therapy if your cancer is hormone receptor positive. And there's also targeted therapy, which is usually HER2 positive targeted immunotherapy. And your treatment plan will be tailored to your specific cancer, your age, your health, and your preferences. You're not alone. You will have a team of doctors, nurses, and specialists who will guide you through every step of this journey. You will have support groups, counselors, the other women who've been through this all and have come out the other side. And you will get through this. I've seen hundreds of women go through breast cancer treatment, and the vast majority of them are doing well. They're living full, happy lives. Yes, this is hard. Yes, this is scary. But you can do this. So let's recap the 3 simple steps for handling a breast lump. Step 1, don't panic, but don't ignore it. Most lumps are not cancer, but you need to get it checked. Age matters. Timing in your cycle matters. Red flags matter. Step 2, see your doctor and get investigations. This means clinical examination, imaging, and possibly a biopsy. Step 3, act on the results. If it's benign, you're okay. If it's atypical, we either take it out or monitor you closely, or both. If it's cancer, we make a treatment plan and you fight. The most important thing is this: don't let fear stop you from getting checked. I know it's scary. I know you're worried. But the worst thing you can do is ignore a lump and hope it goes away. Because if it is a cancer, catching it early makes all the difference. And if it's not cancer, getting it checked will give you peace of mind. So if you found a lump, make an appointment with your doctor. Today, not next week, not next month. Today. Now you know exactly what to do if you find a breast lump. For majority of women who've been diagnosed with breast cancer, even after they've done everything right, they still end up blaming themselves for their diagnosis. And that guilt can be just as damaging as the cancer itself. So check out this video where I explain why 99% of breast cancer patients blame themselves, and more importantly, how you stop that cycle and focus on what really matters, your recovery.